Hi, this is Paul Wise and welcome to the Lawn Vets video series. In this short video I'll be sharing with you some information on the common worms of dogs and cats. Adult roundworms when passing your pet's feces look like white pieces of spaghetti several centimetres long. However, their eggs are microscopic and you will not be able to see them. Tapeworms are different. They look like moving grains of rice and you may well see those moving around on the anus of your pet. Both worms have complex life cycles, sometimes involving intermediate hosts, which fortunately you as owners don't really need to understand. Roundworms or Toxocara cause the typical pot-bellied appearance that we sometimes see in puppies. Heavy infestation can block the intestines completely, or they can cause anemia or diarrhea. Toxocara worms are an important zoonosis. This is a name given to a condition which can transfer from animals to humans. This is particularly important in young children where migration of the larvae can cause several problems. The main one, which you may already have heard about, is when they reach children's eyes, they can cause a progressive loss of vision or even, in some cases, blindness. They can also go to the lungs and liver and indeed the nervous system. So this is one of the main reasons why we worm dogs on a regular basis. It's not just for their benefit, but also for human health too. The fewer Toxocara eggs present in the environment, the lower the risk to our children. Moving on to tapeworms, the most common type of tapeworm in cats and dogs is Diphylidium. They pick this worm up by ingesting fleas because fleas contain part of the life cycle stage of that tapeworm. Other tapeworms can be caught from eating raw meat, so this is perhaps more common in, say, in cats with their hunting activities where they eat rats and mice. Dogs can also pick up tapeworms by eating raw or undercooked lamb, beef or pork. Let's talk about the treatment. Depending on the risk of reinfection, a typical worming regime for cats and dogs is worming every 2 weeks from 2 to 3 weeks of age until they're 12 weeks old, then monthly until they're 6 months, and thereafter every 3 months. Most worming products merely kill off the worms that are there at the time, and some cheaper pet store or supermarket products are only 80% effective. In general, worming products have little or no residual effect, which is why we must use them frequently. In recent years, we've seen an emerging threat in the form of lungworm in dogs. This is picked up from slugs and snails and can lead to dogs developing a chronic cough, general malaise or developing clotting disorders. Slugs and snails carry the lungworm larvae and dogs can become infected when they accidentally or indeed purposefully eat these common garden pests whilst roaming around in undergrowth, eating grass, drinking from puddles or outdoor water bowls, or they pick up their toys if the toys have been left out in the garden. A recent survey suggests that Angiostrongus vasorum, which is the lungworm that affects dogs, is now endemic through much of the UK. Not all routine worming medications are active against this particular parasite. Cats also get a lungworm, although this is a different species to the one that dogs pick up, and appears fortunately to be uncommon. As always, if having watched this video you have any questions, or if you encounter any difficulties, then please phone or email the surgery. We're here to personally help give you the very best advice and treatment possible for your much loved pet. Having watched this video, any feedback will be very much appreciated.